Hello, welcome back to the Harmony Inspired Health podcast. Today, we're going to be talking about a topic that I know a lot of you will be interested in because you're probably fighting it or suffering it yourself, and that is chronic bloating. Now, chronic bloating isn't just uncomfortable, it is your body trying to get your attention. And today, I am joined by functional medicine doctor, Dr. Kate Davis, who went through her own gut healing journey before helping hundreds of women get to the root cause of their symptoms. So if you have ever felt like you've tried everything and still can't beat the bloat, this episode is for you. Welcome to the podcast, Kate.
Thank you, Dr. Harmony. I really appreciate you, having me on here. It's definitely an honor. And yeah, I'm excited to talk about bloating and, get some people some answers.
Yeah, that will be amazing. I think so many people will be tuning into this one. Now, I know your story starts with your own battle with chronic bloating and gut issues. So, can you take us back to what your health journey looked like and what eventually helped you uncover the truth?
Yeah, absolutely. Well, I first got into the functional medicine world, obviously, because of my own story. I was really, really sick when I was around 24 years old, mid 20s. I had a lot of constipation, a lot of bloating, acid reflux, you name it, I had it. It was horrible. And so I actually went a 13-day period without having a single bowel movement. So constipation was the worst. And then the bloating kind of came because of that. And I didn't find any answers in Western medicine. They gave me two terrible options, take this drug the rest of your life that has a permanent side effect of, facial twitches. And I was like, no, not doing that. And then the other option was, well, we can remove your intestines. And that seems to be the only, right? That's the only options they give you. Right? They're like, let's just remove the organ if it's not working. And I'm like, I'm gonna go try to find someone else, but thank you for that advice. I was just so blessed to have come across this doctor who, did myofascial release in the abdomen. And I swear I lost about 10 pounds that night that he worked on me, Dr. Harmony. Like, it was such a relief to be able to go to the bathroom again. A lot of the bloating kind of went down, and I was just miserable. Like, I was really healthy. I was young. I was a former D1 athlete, which in the States is, kind of a big deal. And, but yeah. And so I was doing all the right things. I was fit, I was healthy, but I had these horrible issues. And, after he, did that myofascial release on me and got my stomach functioning again, I completely overhauled my diet. I switched to, really strict paleo, gluten-free, dairy-free diet. And I know there's probably a lot of people listening who are probably on that diet right now. And it's amazing, initially, but my symptoms never went away. They were about 90% better as long as I stuck to this really, really strict diet. And I went like that for about a decade. And, I had a stressful life event happen and all my symptoms started coming back. I'd kept them at bay with diet, but as you know, and I know you've talked about this on your podcast before, stress is a huge trigger for a lot of health issues. And, I was basically on the verge of an autoimmune disease. Like, I was getting swelling in random joints in my body. I had huge fatigue issues and all my gut issues came back. And luckily my friend was in town who's a functional medicine doctor. And she just looks at me and she goes, Kate, you either have Lyme disease or parasites or both because none of your symptoms make sense. Like, you should not be having all these issues. Let's get some testing done and see what's going on. And, you know, I had a lot of issues show up on testing, the biggest one being a massive parasite infection. And it wasn't until she put me on this protocol to, get rid of all the infections, heal my organs. I had a 3-foot long parasite come out,
Oh my
3 feet. It was gigantic. I don't even know where it was living in my body. And after that, all my symptoms started going away. And I was just so blown away by how, this little tiny creature growing in your body could create such massive issues for such a long period of time. And, ever since that experience, I just kind of launched full force into functional medicine, and I've been able to help hundreds of women heal from bloating and constipation and acid reflux and food sensitivities, being able to eat gluten and dairy again, which I can now. So yeah, that's basically where I started.
Amazing. I find it so interesting. Now, I know we have different medical systems, but the fact that you were offered a lifetime medication or a resection of the bowel,
Mm-hmm.
were you not checked for parasites? Did you not do stool samples? Did you not get like any CTs or even ultrasounds, abdo ultrasounds or anything like that beforehand?
Yeah, I mean, that's a great question because unfortunately, not all doctors do that stuff in America. It's just we're
Crazy.
very Western medicine driven of like drugs or surgery is the first two options they'll give you, unfortunately. And they did do a study on me to see, how I was moving food from my stomach into my small intestines. And they diagnosed me with what's called gastroparesis. So, for anyone who's ever been diagnosed with that, all it means is stomach paralysis. It means that your food is not moving into your small intestines after you eat in a reasonable amount of time. And it's usually from low stomach acid and poor vagal tone and, all these other things that kind of diminish your body's ability to digest food. And so that's all they did was they said, you have gastroparesis. We can either cut out your intestines or you can take this drug to fix the gastroparesis, which really just means manage the symptoms. They're not actually getting to the root cause. It was actually the doctor who did the myofascial release on me who ordered the stool sample for me. He was a chiropractor. And he was like, hey, I think you might have parasites. The stool test came back negative. That happens a lot where people, most of them are false negatives where it says, hey, you don't have parasites. And then you find out later on when you do a detox, I did have parasites, they just didn't show up in the stool sample. So, that's all they did, basically.
Yeah. I mean, that's so crazy to me because I think even if you go to the like through the medical system, um, and I do work with medical doctors and refer to them, that here in Australia, if you were a female, a young female or any female, and went to a medical doctor with chronic abdominal bloating, they would obviously talk to you about constipation and diet and maybe try some enemas. If it kept coming back, because I've been through this myself, like you have the CT scans. They also want to rule out like any gynecology stuff. Like they want to know it's not ovarian cancer because that can present as bloating. Endometriosis obviously gets sort of diagnosed years and years down the track if you haven't sort of got answers from anything else. But they would do a stool test and, yeah, send you for scans and pathology and all that. So I'm shocked that you were told to
Yeah.
have bowel section. I'm like, "What?" That is crazy to me. But okay, I can see why it drove you right into functional medicine.
Yeah.
Yeah,
And not to say that all medical doctors are like that, it just happened to be the 2 that I went to. That's how they practiced, and it's not everywhere in America. Obviously, I live on the West Coast, I'm in California, there's a lot more naturopaths and functional medicine doctors and integrative, medicine MDs out here who really do see the value in both, but that's not the case in the South. If you're in Georgia, Florida, Alabama, it's really just straight Western medicine.
yeah. I think what they're doing is just trying to rule out anything sinister like the big tumors and cancers and all of those type of things. Because at the end of the day, if they do find something more like parasites or, I mean, they don't do the full gut microbiome mapping. So they're not looking at like your bacteria and all of those type of things. They don't even do SIBO testing at the moment, small intestine bacteria overgrowth. You do have to go to someone like myself or you functional medicine doctors to get that done. But I guess once they've ruled out anything really dangerous, the treatments, let's throw some antibiotics at it if it's like, they think it's parasites. I mean, they will test for H. pylori and stuff like that. Again, a lot of antibiotic treatment. But yeah, so they don't treat it the root cause and like we would. So I'm not saying like that they're amazing at that, but I definitely think they do a better job at screening here.
Yeah. Yeah, and absolutely, like, other countries, I've heard that from so many people. I have a lot of friends who live in Europe, and they're just like, "What is wrong with y'all's medical system?" And I'm like, "I don't know, this is just where we're at." And so, a lot of people do really seek out the functional medicine. Like, I actually have a lot of patients in the South because they don't have functional medicine doctors over there. So they'll reach out to me and say, "Hey, do you work with people in my state?" And, it's so different across America. It really depends on where you're at. But yeah, that was just my experience. But there are a lot of really amazing MDs out there who are going into more integrative, which I think is really amazing because we really do need both, right? Like you need to screen for cancers and tumors and all that stuff. But then once you don't find a clinical issue, that's when, functional medicine doctors and naturopaths and acupuncturists and chiropractors really thrive in that subclinical space of, okay, nothing's showing up on testing. There's obviously something deeper going on that's not going to show up on, standard blood work or an endoscopy or colonoscopy or any of those standard tests that medical doctors give you.
And how big did you say your parasite was?
It was 3 feet long. It was
That guy was really going for it.
my god. How did what?
How did you get rid of him?
Yeah, so it oh my god. I was so skeptical. When my friend was like, "Hey, you have parasites." Initially I told her, "Hey, I did a stool test like, 9 years ago. It said I didn't have them. I don't think I have parasites." She's like, "Well, we're going to heal your gut first. We're going to go after gut parasites." She put me on this product that has mimosa pudica seed in it. It's one of the best ones for getting rid of intestinal, like ropeworms, roundworms. If you have tapeworms, you might see some come out. I've had very few people see tapeworms come out. That's not very common. But yeah, and that was the supplement that she had me on. And obviously, obviously we're going to talk about this, but like I did it in a safe way. Please don't go out online and just order mimosa pudica seed and start taking it. You will probably feel terrible. Like we really had to heal up my leaky gut. We had to support gallbladder function because I had really bad gallbladder issues. And we had to really heal those organs first before she even put me on that parasite cleanse. So it was about 2 to 3 months in that I actually saw this worm come out. And I had hundreds of other ones come out that were smaller, all different shapes and sizes. I mean, I was infested. It was terrible, but it was really that one supplement that I saw the 3-footer come out. And I remember calling her and I was like, "Oh my God, you're never going to guess what just came out of me." And she was like, "No way." And she's like, "I told you you had parasites." And she's got a really big, thick Southern accent. So it's just funnier when she says it. She's like, "Hey, I told you." And just,
I hope you got a
it's
photo
so
of
funny.
it.
What?
Hope you got a photo of it.
Okay, honestly, I really wish I had, Dr. Harmony.
Yeah.
I've gotten photos of the other ones that came out, but I remember looking at this thing because if any of y'all are squeamish, just, mute for the next 30 seconds and then come back on. But when you have parasites come out, especially in the gut, they usually come out with a lot of, it's called like mucoid plaques or mucus plugs. A lot of mucus will come out because you have to have a really intense immune reaction to get those suckers out of your body. Like they're really hard to get rid of. They're very, very sneaky. They hide from your immune system really well. So it comes out with a lot of nasty looking stuff. It's obviously coming out in your stool, so it's covered in feces. So it's not the most pleasant thing you'd want to show to people. So I remember looking at this thing. I had gloves on. I had the long Q-tips because I was trying to find like if I had parasites. And I remember looking at this thing and I was like, nobody's going to want to see this. This is disgusting. This looks horrible.
It's no
And the
moment.
next day, all my friends were like, "Show me a video. Did you get a picture?" And I was like, "No, I just flushed it down the toilet because it looked gross. I didn't think you guys would want to see it." And so then ever since then, I started taking pictures of like the 1 or 2 footers. I still have those on my Instagram. If you guys want to check them out, I have some pictures on there. But yeah, I had at least a dozen more between 1 and 2 feet long come out after that big one. And all my symptoms completely went away after that 3-footer came out, and they kept getting better as I continued healing my body. So it was wild. I was really shocked that I actually had that bad of a parasite infection.
Yeah, that's crazy. So just taking it back a bit,
Yeah.
what have you seen? Actually, no, we're taking it forward, I guess. So now that you're a functional medicine doctor, what have you seen to be the biggest root causes for chronic bloating in women today? Because there's so many different causes.
Yeah, and that's such a great way to phrase the question, Dr. Harmony, because there really are so many different answers.
Mhm.
Like a lot of people, I think we're so stuck in this mindset of one problem, one solution, but we have to really think outside the box and say, okay, for this specific person, what could really be causing the issue? 2 of the biggest things, I'll give you the top 2 because I think they're pretty much tied for first, but the top 2 that I see are actually poor gallbladder function. So when your gallbladder becomes sluggish, a lot of people don't know this, your gallbladder is actually what stimulates bowel movements. So if you don't have good release of those bile salts into your intestines, it's really hard to actually go to the bathroom, 2 to 3 times a day, which is what's considered normal for a healthy gut. And so if you don't have good gallbladder function, first of all, you can't kill off infections that reach your small intestine because that's also one of the functions of the bile salts. And so then you get bacteria overgrowing, and that's what creates that upper abdominal bloating is gallbladder issues, SIBO, like you talked about earlier, where you get an overgrowth of that bacteria because you're not producing enough bile salts to kill off those infections when they hit the small intestine, or you're not producing enough stomach acid. And so that is also a function of the gallbladder. It actually tells your stomach to produce enough acid so you can digest your food, but so that you can also kill off parasites, bacteria, viruses that you ingest every time you put food in your mouth. And so if you have low stomach acid and gallbladder dysfunction, that is just a breeding ground for SIBO, which I had, for, upper abdominal bloating, which I had, for constipation, which I had all those issues. And it really just rooted in organ dysfunction and low stomach acid. And a big thing that triggers those issues too is if you've ever had a head injury, that actually can damage the vagus nerve because it sits at the bottom of your brainstem. And that is what also triggers good bowel movements, good digestion, all that stuff. So there's so many things that kind of play into it. And, that's why it's really important to know someone's full health history, to know their stress levels. Because for those of you who don't know, stress has been shown in research, chronic stress over a long period of time, to create leaky gut, which is also another, I'd say probably the number 2 or 3 source of bloating in women.
Yeah, do want to come back and talk about the stress component because I think that a lot of the times people are told, oh, you've got bloating, it's stress, or you've got hormonal imbalance, it started off with stress. And a lot of people, because they don't know the pathophysiology of what stress does on your body, because we're actually talking about hormones creating sort of an imbalance in the body, they think it's sort of just a throwaway term that they're given and that then they feel like it's all their fault. So I do want to go back to that. But before we get to stress, I want to ask, how do people know if their gallbladder is sluggish? Like, how are you diagnosing that that is the number one cause?
Yeah, it's a great question because it is hard to pick up on. There is a test you can get your doctor to order called I believe it's called a HIDA scan that will show you that, but it is expensive. Most insurances won't cover it. It's like maybe $300 or $400, where you can actually see if your gallbladder is sluggish, and they'll kind of give you the output of how well it's functioning. An easier way to determine it is really based off a lot of people's symptoms. If I see, especially the classic ones, like if you have, radiating pain that goes to, right by the right scapula, on your right side near that right scapula, the shoulder, the mid back area, that's usually an indicator of, gallbladder issues. If you've ever had gallstones, you probably have a sluggish gallbladder because that's the only way they form is when those bile salts are slowing down and not getting out of your gallbladder enough, they form those stones. A big one is constipation, indigestion issues, especially if someone has SIBO. I'm immediately thinking there's probably a gallbladder issue. And so you really have to go a lot on symptoms, but then there's also certain tests that can kind of show you, you can look at nutrient deficiencies. Are you deficient in the fatty vitamins like vitamin A, vitamin D, vitamin K, vitamin E, especially for someone, in Australia where you're at, Dr. Harmony, if they're deficient in vitamin D and they're in the sun all the time, that's a huge red flag that they're not breaking down fats. Unless they just have a terrible diet where they never eat fats, if they're in the sun and they're still deficient in vitamin D, I'm usually thinking, maybe some gallbladder, probably some liver issues as well. And so it's really just getting a full picture of, what's their micronutrients look like, because fatty acid deficiencies can also be gallbladder related. And there's so many different things you can kind of look at, but it's really just a lot of the symptoms that I see with people really lets me know, their gallbladder is not functioning well. And a lot of them have already had that HIDA scan done and they'll bring me the results and all their symptoms match up with it. And I'm like, okay, this makes sense. So I'd say those are the big ones.
And so, how are you supporting the gallbladder to become more functionally viable?
Yeah, and I know everyone, always asks these questions of, well, how do I fix it? It depends on you. I know everyone hates that answer, but it's really this individualized approach of, first of all, we have to ask the question, why isn't your gallbladder working? What's damaging it? A lot of people don't know that mold toxins can actually bind up the bile salts and create that sluggish gallbladder. Heavy metal toxicity, your gallbladder is the number one organ that gets rid of heavy metals from your body. So if you have, a lot of heavy metal toxicity, some mold toxicity, that can damage the gallbladder. Liver issues can also damage the gallbladder if you're chronically inflamed from, if we bring it back to the hormones from high cortisol, high insulin, that can also inflame the liver and create a lot of downstream effects on the gallbladder. There's so many different reasons for it, but a really good supplement to help support it is TUDCA. I don't know if you ever prescribed that, or TUDCA. Everyone pronounces it different, but it's a really good, it's basically a bile salt supplement that just helps clean out the gallbladder. And when I put people on that, they really notice, a huge difference in bowel movements and digestion, in bloating, because now they're able to kill off those infections that are overgrowing in the intestines. They're able to stimulate bowel movements so that their waste products actually get out of their body and don't just stagnate on the intestinal walls and create, more bacterial overgrowth and more bloating and more gas production. So it's really so many different factors that I wish I could say, here's the one answer for this, but there really isn't one. It really depends on you and what is damaging it in the first place.
And that's why we do things different in functional medicine and Ayurveda
Yep.
and TCM, all those things, because it really is an individualized medicine. So,
Yep.
whilst we might be giving some tips here on the podcast, it's really educational. So, please don't go and,
Yeah.
think, oh, that sounds like me. I'm going to go and get this supplement, because you could be doing more damage than good if it isn't actually diagnosed by your functional medicine practitioner. I know even
Mhm.
as an Ayurvedic practitioner, we talk about gut health and bloating a lot because we see Agni as the source of our health, and Agni is our digestive power, our metabolic power. And for different constitutions, we would support it very differently. So if someone has a higher Vata constitution, meaning that they get bloated really easy, really gassy, they've got low Agni, so they're not digesting their food very well, but they're also not like big people. They're usually quite slim people and like they're always eating cold salads, and that is actually aggravating their Agni. Whereas if they're Pitta, they might still get some of that bloating, but it's more of an heated inflammatory bloating. And a Kapha, they would have like this heavy, dense feeling and this dense bloating. So we actually need to give them more lightness. Whereas if we did that with the Vata person, that would increase their lightness and their gassiness and their bloatingness. So the herbs, the supplements, everything is prescribed on an individual basis. And it's the same as functional medicine. Like you have to, it really does rely a lot on symptomology and understanding what those symptoms could mean, because we can all come in with bloating, gut health issues and have completely different things going on. I think that's just really important caveat to people out there. But I did want to get back into the discussion around and bloating and the triggers there, because I do see this so much. And even like with low stomach acid, as you've been talking about, the gut-brain axis, all of those type of things, trauma, how it affects the gut and why it's not just a throwaway sort of diagnosis that can be given. So can you sort of, speak on that? And
Yeah, absolutely.
motility as well.
Yeah, absolutely. I mean, it's such a great discussion because, yeah, you're right. A lot of people, especially in America, I don't know if it happens as much in Australia. It sounds like you guys have maybe a better system than we do, but a lot of women will come to me and they say, yeah, I went to my doctor and they didn't do anything. They just told me, oh, it's stress related. They didn't check for, candida overgrowth or parasites or gallbladder dysfunction or any of that stuff. They just amount it to stress. And yes, women are more emotional beings, so it's understandable that doctors would just think, okay, maybe they just have a stressful lifestyle, and that can absolutely trigger these gut issues. And one of the biggest things is, for those of you who don't know what leaky gut is, basically your stomach, your GI system is the only one that's kind of isolated from the rest of your body, because we don't want waste and toxins mixing with our bloodstream. Because once you get toxins spilling into your bloodstream, they can go to all your organ systems and create inflammation and, things like brain fog or liver issues that create the hormone dysfunction that you talk about a lot on your podcast. And so we have this barrier between our gut and our bloodstream, and it's very small holes. It's what's called like kind of semi-permeable, or only small nutrients from your food are being extracted and sent to your bloodstream and going out to the rest of the body to provide nutrients and building blocks to function on a daily basis and do everything that your body needs. It's when we get inflammation in that gut lining that causes those cells to start spreading, and now you get these giant holes in that intestinal wall, and now we get food particles that can slip through and trigger immune reactions. That's why a lot of people are gluten sensitive or dairy sensitive, even though they could handle that when they were kids. Or I've seen garlic, avocados, like all sorts of crazy food sensitivities people didn't have before. And it's when that gut lining breaks down, now you get toxins that can spill back into the bloodstream and put a lot of stress on the liver, because your liver is the main organ that really pulls and detoxes for you and gets it out through your bowel movements. It's like the number one way we get waste out. So that's why it's so important to go to the bathroom 2 to 3 times a day. Otherwise, that waste builds up in your intestines, creates that inflammation, and perpetuates that leaky gut. So the reason I'm starting here is because stress, if you look at research, you'll never see it called leaky gut. It'll be called increased intestinal permeability.
Mhm.
They've shown that chronic stress over a long period causes that leaky gut. And what's also really important about that is that leaky gut is the precursor to all autoimmune disease. So if you want to prevent inflammatory issues, if you want to prevent, all this stuff from spilling into your bloodstream, you've got to really focus on not only healing the gut by removing those things that aren't supposed to be there or supporting liver and gallbladder function, but you've also got to calm down your nervous system. We've got to get you out of that fight or flight state into that rest and digest state. Because if you're stuck up here all the time and you're constantly go, 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 stressed out, not taking time for yourself, not prioritizing sleep, not doing grounding, not avoiding screens at night, there's all these different things that influence that. It's really going to affect your overall health, especially when it comes to gut health, because it will create that leaky gut that just perpetuates all of these other issues that eventually down the road, as you've seen, Dr. Harmony, lead to hormone dysfunction. because there is that, that gut bacteria, the estrobolome that helps regulate estrogen and progesterone. And then when you get that spillage into the bloodstream from the leaky gut, now we're putting a ton of extra stress on the liver. The liver is where hormones are recycled and broken down every day. So then you might get estrogen dominance and going into all those issues like PCOS and, things like that. So stress really does affect your body. It's one of the two master hormones in your system. You've got insulin, cortisol. They're kind of like the little puppeteers controlling thyroid hormones and estrogen and progesterone to a certain extent. And so they're I know doctors do gaslight some people with that, but sometimes they really are on the mark in terms of if we can just down regulate your nervous system through simple things, like not looking at your screen an hour before bed, going and doing some grounding at sunrise or sunset, getting your feet in the earth, letting that orange amber light hit your eyes and reset your sleep cycle so you can get better quality sleep, so you can heal and produce hormones at night when you're sleeping, then it just has this whole effect on your body. It's just a whole systemic effect. It's not just one thing. But that is a huge piece of the puzzle for a lot of people I work with, is we really have to mitigate stress, because there's always going to be things that happen in your life that are out of your control. And if you don't have ways to mitigate the effect that it has on your body, it's eventually going to lead to some sort of chronic disease issue. And we don't want that to happen. So that's kind of where I view stress. And obviously, I used to work with a lot of, concussions and brain injuries and things like that. And so I incorporate that neuro stuff into the treatment with my patients because of that brain gut connection as well. But also because I know that if they're chronically stressed, that gut lining is never going to heal. And if
Mm,
that gut lining never heals, your food sensitivities are never going to go away. Your bloating's never going to go away. You're not going to have normal bowel movements. And it just really affects your whole body. And eventually people get, oh, I'm 35 and I have adult acne. This doesn't make sense. I never had acne before. Or they get PCOS or endometriosis, or, maybe they have infertility issues because now their hormones are messed up because they never really addressed that, that deeper root cause.
absolutely. And it's exactly what Ayurveda always says, healing starts in the gut and the nervous system because it's
Yep.
so intricately connected to all of the issues that we have when we track it back. I really loved how you explained all that. And I think it just gives people a bit of better understanding and even a peace of mind that maybe they're not being gaslit all the time. It's like when people are saying, specifically practitioners are saying that we really do need to monitor the stress, it's not just because it's like a funky, cool thing to sort of have on an Instagram reel these days. There's actual science behind it. There's proof, and there's actual physiological changes that happen in the body due to a stressful lifestyle. And it is becoming harder to manage these days because we're so busy and there's so much to take mind of, but we do need to start to figure out those tools that are going to support our central nervous system. And as I was saying before, from an Ayurvedic perspective, like uh, people who are more in the lens of a Vata constitution, they get a lot of bloating and gas and gut health issues. But Vata also governs the central nervous system. So they go hand in hand. And I think it's so important to understand that. One thing you did mention is your brain injury clients and
Hmm.
trauma in the brain. And I find that really fascinating. And I'd love to dive a little bit more into the gut brain axis and the vagus nerve and how this all works together.
Yeah, no, it's a great topic because a lot of people don't think about that. But part of my story too is that I had a really severe head injury when I was 18. That's actually how I got into all the neuro, and I think that's what triggered my severe gut issues. Like 6 years down the road. And, the doctor I went and saw who did that myofascial release on my gut, he also was a what's called a functional neurologist, where basically you're kind of using the functional approach of, okay, let's figure out what part of the brain isn't working. Let's activate it and even it out on both sides. Because if you have a, dysfunctional brain where one side's working harder than the other, it's going to affect your whole system. There's that, it's called the neuroimmune endocrine axis, which all that means is your brain and your immune system and your hormone system, they all function together. So again, there's another piece of the hormone puzzle is, well, how's your brain functioning? Have you ever had a head injury or even a whiplash injury? They're now finding with research is more damaging to your brainstem than actually hitting your head on something and having like an impact injury, because most whiplashes are at a rotational force, and that bottom part of your head, that top part of your neck, is where the bottom of your brainstem is housed. And so when you basically take your brainstem and wring it out like a sponge, you're damaging a lot of those neurons in that part of the brainstem. It's called the medulla, and that's where your vagus nerve lives. And so that vagus nerve basically signals to all of your internal organs, not just your gut, but all of your internal organs to function properly. So even people who have, oh, I have high blood pressure or POTS or low blood pressure. Okay, well, have you ever had a whiplash injury or head injury? Okay, maybe we need to address, maybe there's some vestibular dysfunction, which is your balance center in the brain. Maybe there's some coordination issues, which is the bottom of your brain, that cerebellum. Maybe there's some frontal lobe issues. And depending on which part of the frontal lobe has issues, that can also affect your gut. And so there's this huge connection between brain function and gut health that people don't really ever know how to address, or they're not really aware of, maybe that one car accident I was in, triggered a lot of this gut stuff that I'm dealing with. And so I think it's really important too to kind of have that understanding of, okay, how can we maybe support brain function? And that's a whole other topic. It's so complex, but once you learn it and you understand how to help people, it's so fun to do that stuff because they would come in with chronic pain in my chiropractic practice. Oh, I've had this ankle pain for 5 years. Cool. We do like one eye exercise. Now all of a sudden their ankle doesn't hurt and they're freaked out because they're like, I've been to so many PTs, so many massage therapists, chiropractors. Why didn't anybody know how to do this? And it's just another piece of the puzzle that I like to add in for people of just, okay, if you've had head injuries, let's focus on some brain health. Let's get your brain functioning better. And kind of going into that piece of the puzzle. But also your vagus nerve, communicates with your brain and your gut bacteria all the time, telling it what's going on. So if there's a breakdown in that system, you're going to have gut issues. You could do all the detoxing in the world, all the supplements in the world, but if there is that disconnect between the brain and the gut, it's not going to heal fully. So I think that's like part of the whole, like we were talking about earlier, of like this whole comprehensive individualized care plan is so important. It's not just if you have gut issues, it's not just targeting the gut. It's also looking at gallbladder, liver health. Is there a fasting insulin issue that we need to address that's causing systemic inflammation? Is there, a history of head injuries or whiplash injuries that's maybe causing issues with the vagus nerve? And then in terms of just healing that vagus nerve, there's really simple things you can do. If you just do humming or gargling or, like breathing exercises are so helpful for that, or getting someone to do some gut release techniques, like if they're specialized in myofascial release for the abdomen, that's really big for, activating that vagus nerve again too. And so I think it's definitely a bigger conversation. I wish I could kind of condense it down into like a short one, but hopefully that made sense.
Yeah, it's so fascinating. I'm even like linking up through my gut health journey in my life.
Yeah.
Like I remember when I was really young, I could just like eat anything and I would just have the flattest stomach. And my grandma
Yep.
would always say, "Yeah, eating again. How can you eat so much? Where does it all go?" Very spotty too. But I did then got into horse riding and I grew up riding horses and I had some really bad falls and I had spinal shock. And then my gut health slowly started to deteriorate. I mean, it got a lot worse after the birth of my kids. So it's like a long process. But really through the Vedic breath work, we call it Brahmari, the bumblebee breath, where it's like the humming to help with
Mhm.
the nerve. It definitely supports my gut health. Like I know 100% that it really supports it, and it's purely probably just retonifying the vagus nerve that I have damaged over many, many falls and many head injuries and all of those things. So, yeah, it's really interesting when you start to click it all together for yourself as well. So we have mentioned the hormone gut connection, but I'd like to speak about it from the lens of how does gut health issues show up uniquely in perimenopausal women and beyond where the hormones are shifting?
Yeah, I'd say a lot of perimenopausal women that I've worked with, a lot of them really deal with, I mean, your hormones are really, tanking. Like obviously estrogen drops a lot, which can affect so many different systems. But I think the biggest thing I see with perimenopausal women is probably constipation and bloating is like a big thing I see. And I think that's definitely more of your realm of, like explaining like why all the hormones kind of affect that. But I think it's just because all the hormones interact with each other, right? Like if you already had an insulin issue prior to going into perimenopause, that's obviously going to affect downstream hormone production as well. And so, and high stress as well. If you haven't found a way to really mitigate stress levels, that's going to affect your hormones as well. And I've seen so many people go through perimenopause and they have zero symptoms and they're doing totally fine because they really did address a lot of that stuff early on. And so I think really just focusing on before you get to that point, and even when you're at that point, if you're having issues, obviously see someone like you who can really help balance the hormones out. Or, if it is an insulin issue, try to find someone who can really help bring that blood sugar back down and the insulin back down to normal levels. And sometimes that does involve seeing a functional medicine doctor because maybe it's chronic inflammation at the cellular level that's really preventing that sugar from being pushed into your cell by insulin. And that's why you have the insulin spike. Because I've also seen healthy women who are normal weights, they work out all the time and they have really high fasting insulin and blood sugar and they don't know why. And it's really just at a micro level, their cells are just inflamed and they're having trouble getting the sugar into the cell. And so really just reducing that inflammation, whatever the case may be, if it's leaky gut, if it's mold toxicity, parasites, liver issues, whatever the case is. But I think it's really just focusing on prioritizing, lowering stress, keeping your fasting insulin at good levels before you hit that point. That I think helps mitigate symptoms the most. At least that's what I've seen in the people I've worked with.
Absolutely. And whether we like it or not, the fluctuating hormones in that sort of phase makes us less stress resilient. It's annoying, but it's just a fact that we have to deal with. So we have to be on top of it even more so. So what would you say with all of your experience, what are some of the most common mistakes that you see people make when they're trying to fix their gut issues on their own?
Yeah, well, I think you named it right there, fixing it on your own. I think that's definitely the number one, and I get it. It's like people just want we're in a society of such quick fixes that it's so hard to get people to kinda realize, like, "Hey, if you want to get there faster and safely, go find someone to work with." Like, I get it. Some people are just like, "No, I just wanna try these supplements I've seen on Instagram," or, "This gut cleanse I found, I think I'm just gonna try it on my own," and I have so many people who reach out to me and they're just like, "What parasite cleanse did you use?" Or, "I wanna do a parasite cleanse," and I'm like, "Great. Do you wanna get some testing done first to see what's going on in your body?" "No, I just wanna do it myself." And people just don't realize, okay, if you just jump on something, first of all, you don't know what you're targeting. You don't know what's going on in your body. So what are you targeting? You're just throwing spaghetti at the wall and hoping it sticks. Or like, throwing a blindfold on and throwing a dart at a dartboard and hoping that you hit the center and somehow heal yourself. And so it's really important to like go to someone who can really just take their, years or decades of experience and just listen to your symptoms, your health history, look at your labs and come together with this really unique individualized care plan. So I'd say the biggest mistake I see is people jumping on the latest trend or like someone's like, "Hey, purchase my detox product, you get 10% off for the next 7 days." And people are like, "Oh, well that's cheap. I'm going to go with that one." But if you're I always tell people like if you're going to buy cheap products, expect cheap results, because the things that actually work oftentimes will cost more money, but it's going to save you so much more in the long run because you're going to shortcut that trial and error process of ending up with the supplement graveyard in your kitchen pantry. Like a lot of people who see you probably are having, their grocery bag full of 40 supplements that they've bought and maybe they haven't taken half of them or they tried half and nothing helped. And they're just basically pouring all this stuff into a system that's already struggling, that maybe the liver is already struggling to break down toxins and waste products. Now we're throwing a bunch of supplements with fillers and additives and all this stuff in there. And people just don't realize that even supplements can stress your body out and create worse issues. And so I'd say the biggest issue is just trying to find one solution for one problem and not looking at a more detailed evaluation of how your body is really doing. Because you really do need to understand, if I don't have good drainage organs, if my gut isn't working, if my gallbladder and liver are struggling, I can't even get toxins and waste products out effectively. So when I start detoxing and killing off parasites and they release a bunch of toxins into my system, I'm going to get detox reactions, herxing. Some people even end up in the ER because their body is so messed up from a foundational level that they just end up making the problem significantly worse and ending up in the ER with severe stomach pain or migraines. Or, I've heard this from so many people, by the way, because obviously I post so much on parasites because of my own story that I get so many people who have told me, "Oh my God, I did exactly what you tell us not to. And I just jumped on a generic cleanse and now I feel terrible." And, I end up having to fix these people when if they had just seen someone to begin with, they would have saved themselves a lot of hurt and a lot of money and a lot of time, getting there. So I'd say that's probably the biggest thing I've seen.
Yeah, absolutely. And I'm glad you brought up that over supplementation because, I've seen that in some clients recently come to me and they've got buckets full of supplements. And I'm like, whoa, half of these are contradicting each other to start.
Mhm. Yep.
And you must be really full after your breakfast amount of supplements. Like, are you actually fitting nutrients in your gut? So, yeah,
Yeah.
it's really important to nail down the right ones. So, I would love to wrap it up by asking you what are three powerful things that a woman struggling with bloating can do today to help her situation?
Yeah, I think that's a great question. And again, this is generic advice, you guys. You got to figure out what's going on in your body first. But I'd say number one is get some testing done. Go see someone who can really just get a good idea of your organ function. Do you have some lingering infections or toxins in your body? Really get a full picture of what's going on, who can really look at your health history and just shortcut the process for you. It's really just going to save you so much time. I wish I had done that instead of struggling for almost a decade before I figured out what was going on in my body. But we live and learn. And, here we are. I'd say definitely seeing someone to get some testing is going to be the best way that you're going to really heal at a foundational level that's going to give you long lasting results, not just temporary band aid solutions. Number two, I would say I would say definitely stress management. Simple things you can do. Go look up breath work. There's probably 1,000 videos on YouTube that you can look up. I would not start with Wim Hof breathing. So if those of you are, don't start with that. That's going to actually raise cortisol. It's not going to help lower it. But I would start with just some basic like box breathing. You can breathe in for 4 seconds, hold for 4 seconds, breathe out for 8 seconds, hold for 4 seconds, and just do that. Set a timer on your phone for like 5 minutes. I guarantee you will feel so relaxed after that 5 minutes that it will completely change the rest of your day. And it's really just these small things that you do on a daily basis. That's what really creates the biggest change. People think they have to do some crazy biohack or, do all this stuff of like, oh, I'm going to go get, an IV drip and get all these nutrients flushed into my system. When in reality, if you just I'd say prioritizing sleep is honestly another one because a lot of people don't realize, but if you don't go to sleep at a good time, your liver can't detox, your hormones don't get produced properly, and it really screws up your hormones long term, and your body isn't able to heal. And your brain actually detoxes at night too through that lymphatic system around it. And so I'd say if you prioritize sleep, if you work on down regulating your nervous system with just simple breathing exercises or grounding at sunrise and sunset, because that's going to help regulate your sleep cycle too. And then if you go see someone for really specific testing to really get a good idea of what's going on, I think you'll definitely be on the right track to feeling better and getting rid of that bloating, permanently.
Yeah,
So,
absolutely. Beautifully said. And I think remembering that one man's medicine can be another man's poison. So it is
yep.
really important to get individualized treatments and an understanding of what's going on. Even, for instance, like I've had a lot of clients that have come in with all of the symptoms, and when we've tested, they've got SIBO, but they've been living off a diet of like fermented sauerkraut and kombucha because they've heard that's really good for your gut health. And you're like,
Yep.
yeah, not for your gut though, not right now. It's
Yeah.
increase all of your symptoms. So, what we're told on Instagram, and like those things are good for your gut, but in a semi healthy gut as a preventative measure.
Yeah.
If you've got something going on, what is deemed healthy isn't going to be the best option for you. So, really sort of understanding all of that. And I think you've brought so much amazing wisdom, and I really appreciate all of the information that you've given us today. So, if our clients or listeners do want help with their gut health, where can they find you and what can you offer them in the way of support?
Yeah, well, first of all, I just want to say thank you so much, Dr. Harmony, for having me on the podcast. It's been a really good conversation. You asked great questions. And, I always love like talking about this stuff and educating people. So it's always fun to, get on an interview with someone who really knows how to ask good questions and make a great conversation for people. So thank you for having me on. But yeah, I'd say for those of you out there, maybe you're listening to this podcast and you're thinking to yourself, I would love if I could even just not look 6 months pregnant after eating, or if you would just like to go out to eat and not have consequences later on and just be able to eat whatever you want. Maybe you're someone who's like, I would love to be able to go to the bathroom at least once a day. Maybe you're struggling with those other issues associated with bloating as well, or acid reflux. And, maybe you're thinking to yourself, well, I've had this for so long, I don't think anything's going to work, or maybe I'm too far gone. Let me just encourage you to do one of two things. So, first of all, you can absolutely work with me if you're in the US. I work with US people only, unfortunately, but yeah, if you're in the US and you're really struggling and you're like, hey, I really just want to, work with someone who can really get to the root cause, who can really just listen to my full health history, get a full understanding of where you've been, what issues you've gone through, and really get to the nitty-gritty of what kind of is going on in your body and get some testing done to really see a full picture of your health, not just the gut, but a full picture of, everything going on in your body. You can definitely reach out to me on Instagram. Again, my name is Dr. Kate Davis. So if you just look on Instagram at Dr. Kate Davis, so DrKateDavis, you can just follow me on there. I give you guys daily tips, on things you can implement right away. Like the breathing exercises I told you, I have some videos on there about that and the vagus nerve activations. Go on there and just start watching the videos, and that stuff will start to get you on the right track. And if you're someone who's like, hey, I'm really ready to work with someone, I really want to get my health back on track. If you want, the full initial consult, individualized testing, get a really good individualized care plan for where you're at and where you want to go. I am offering a discount for anyone listening to this podcast. If you just DM me on Instagram, again, my name is Dr. Kate Davis, at Dr. Kate Davis. That's really easy to find. If you just DM me the number 100, I'm going to give you guys $100 off an initial consult and labs package. So if you're listening to this podcast and you're like, hey, I really need someone to help me navigate this because I'm tired of, adding to my supplement graveyard in the pantry and I'm tired of, dealing with the bloating issues. I've worked with so many women who have had bloating issues where they look 9 months pregnant after eating or 3 months pregnant, all the ranges of pregnancy after eating. I was one of those people too. Just know that there is hope for you. You're not stuck this way. There is a solution out there. So please don't ever think that because you've been to so many doctors and they haven't given you a solution that there isn't. There's always an answer out there. You just have to find it. So that would be the top two things I would say is, message me directly on Instagram or just follow me and just start implementing the stuff that I have on there for you guys.
Amazing. I'll have all of your links in the show notes as well, so you can just click over.
Perfect.
Thank you so much. And thank you to all of our listeners. I hope you all got something out of this episode. And if you think that this episode would really serve a friend or a colleague or a family member, please pass it on. And if you loved it, take a screenshot of you listening and tag myself at Harmony Inspired Ayurveda and Kate at Dr. Kate Davis on Instagram. Bye.